Hello, this is Dr. Joe Muscolino. The following is an AI-generated simulated podcast of the contents of my ebook. I've created this and providing this because I believe that it is a very casual way and a comfortable way of listening to and absorbing the information. I hope you do enjoy it.
Ever get that pain in the butt? And I mean literally, a pain in the butt. Not just from sitting too long, but the kind that shoots down your leg and makes you wonder if your sciatica is acting up.
Oh, I know the feeling.
Well, today's deep dive might just hold the answer. We're tackling Piriformis Syndrome and diving deep into a comprehensive manual therapy treatment guide for Piriformis Syndrome by Dr. Joe Muscolino.
Sounds like a plan.
And to help us decipher all this, I've got our expert guide right here with me. So tell us, what exactly is this mysteriously named piriformis muscle, and why is it so notorious?
Well, it's a muscle deep in the buttock, and it plays a key role in hip rotation. Think of all the ways you rotate your hip. Walking, running, even just shifting in your chair. The piriformis is involved in all of that.
Okay, so it helps us move. But I get the feeling there's more to it. What makes this muscle such a literal pain in the,
Here's where it gets interesting. The piriformis sits right next to your sciatic nerve, that big one running down the back of your leg. Now, imagine this. If your piriformis is tight, it can actually press on that nerve.
Wait, so you're saying that sometimes what I think is my sciatica acting up could actually be this piriformis muscle?
Precisely. And to make things even trickier, it can cause pain, tingling, or even numbness that goes all the way down to your foot, basically mimicking typical sciatica.
So it's like a case of mistaken identity in the body. No wonder it's often misdiagnosed.
Exactly. And it's not always as simple as, I sat too long. Sometimes the piriformis is working overtime trying to compensate for other issues.
Like what?
Well, one common culprit is a wonky sacroiliac joint. That's the joint in your lower back that connects your spine and pelvis. If that joint is unstable, your piriformis often tries to step in and do the job, which can lead to tightness and that nerve compression we were talking about.
So let me get this straight. A wonky SI joint can make the piriformis go into overdrive trying to pick up the slack.
You got it. It's all about the body trying to find balance.
Fascinating. Okay, so we've got this muscle deep in the buttock that can mimic sciatica when it gets tight, and sometimes it's compensating for a wonky SIJ. This is already giving me a whole new perspective on those mystery aches and pains. So it's not just about sitting funny. What are some things that WE do maybe every day that could be contributing to this whole piriformis saga?
Well, a lot of everyday activities can actually put stress on the piriformis.
Okay, like what? Give us the dirt.
Well, think about how you sit. Do you cross your legs a lot?
All the time. Especially when I'm lost in thought. Is that bad? Should I be rethinking my leg crossing ways?
Let's just say it's not the most piriformis-friendly position. When you cross your legs, you're basically shortening and tightening that piriformis muscle on one side and overstretching it on the other. Over time, that imbalance can lead to problems.
So basically, my legs are waging a war on my piriformis.
You could say that. And it's not just how you sit. Think about other things you do that involve rotating your hip.
Like what? Give me an example.
Driving. Driving for long stretches can be a big one.
Really? I actually do quite a bit of driving for work. And I'm wondering if my car is secretly a piriformis torture chamber.
It all depends on how you're positioned while you're driving. Think about it. Are your knees higher than your hips? Are you constantly pivoting at the hip to reach the gas pedal? These things, especially if you're doing them for hours on end, can put a real strain on the piriformis.
Wow. Never even considered that. Definitely going to be rethinking my driving ergonomics after this. So just to clarify, if someone is listening to this and thinking, wait a minute, this sounds familiar, what are some of those red flags that it might actually be Piriformis Syndrome acting up?
Well, some telltale signs are pain, tingling, or numbness deep in the buttock, often radiating down the back of the leg. It can even go all the way down to the foot, which is why it's so often mistaken for sciatica. This pain often flares up after you've been sitting for a while or driving or doing activities that involve a lot of external hip rotation.
So it's not just a quick, oh, I slept wrong kind of pain. This is a much deeper, more lingering ache that seems connected to certain movements or postures.
Exactly. Pay attention to those patterns because they can be really important clues. But of course, as we mentioned earlier, piriformis syndrome often mimics other conditions, so getting a proper diagnosis is key.
Right, because you don't want to be doing piriformis stretches if it's actually a herniated disc or something like that. Speaking of which, let's talk about how someone actually gets a diagnosis for this. It sounds tricky. So how does someone actually know if it's piriformis syndrome? Is there like a test for this?
Well, there's no single test, unfortunately. It often takes a bit of detective work.
Detective work, huh? So how does that work?
It starts with a good healthcare professional, someone who will really listen to you, ask about your symptoms, how long you've had them, your medical history, any past injuries, basically trying to get the full picture.
So they're looking for clues, just like a detective.
Exactly. And then they'll do a physical exam, they'll check your range of motion, your posture, feel around for any tender spots in your buttock and hip area.
So that's where they actually try to pinpoint that piriformis muscle, right? Like, aha, found you.
Got it. And you know what's really interesting? Dr. Muscolino talks about this in his book. There's actually a specific stretch that can often reproduce the pain.
Wait, they're going to try to make it hurt.
Well, it seems counterintuitive, right? But it's about getting a specific response. The stretch involves externally rotating the hip, which puts pressure on the piriformis. And if that familiar pain flares up during that stretch, well, that's a strong indication that the piriformis is involved.
Uh-huh, so it's like a tell. But once they confirm it's actually piriformis syndrome, then what? How do you fix it? Everyone wants to know that.
Well, the good news is there are some really effective ways to address it, but it's not usually a one-size-fits-all solution.
Makes sense. So what's the approach?
It often involves a combination of things. Manual therapy is a big one, and Dr. Muscolino is a big proponent of it. He talks a lot about specific techniques for releasing tension in the piriformis and the surrounding muscles. Heat therapy can be really helpful too.
So it's about getting hands-on, really working out those knots and tightness, but also using heat to relax and soothe those muscles.
Exactly. And then there are specific stretches, both for immediate relief and long-term flexibility. There's one in particular that he highlights in the book, which he used a lot with his patient Raj. It's called the piriformis stretch in flexion, abduction, and external rotation.
Wow, that's a mouthful. Is there a shorter name?
We like to call it the Faber stretch for short.
The Faber stretch. I like it. Tell me more.
So imagine this. You're lying on your back with your knees bent and your feet flat on the floor. Then you take the leg on the side that you want to stretch and cross it over your other leg so your ankle rests on your opposite thigh just above the knee.
Got it. Kind of like a figure four with my legs.
Exactly. And then you gently pull your crossed knee towards your chest until you feel a good stretch in your buttock. Hold that for about 30 seconds, breathing deeply, and then do the other side.
That sounds pretty doable. And you're saying this one stretch can make a real difference.
It can be very effective, yes, especially when you combine it with the other manual therapy techniques that Dr. Muscolino recommends. And that's an important point. It's often not about just one thing.
Right. It's about a holistic approach.
Yeah.
Speaking of which, we've talked a lot about manual therapy, but what about those underlying issues we talked about earlier, like that SI joint dysfunction? We can't just ignore that, right?
Absolutely not. That's a huge part of Dr. Muscolino's approach addressing the root cause. If you ignore that, the piriformis syndrome is likely to just keep coming back.
Like putting a Band-Aid on a leaky faucet, it's not really fixing the problem.
Exactly. So if the underlying cause is SIJ dysfunction, for instance, then he talks about specific techniques for helping to stabilize that joint. Things like strengthening the core muscles because they play a key role in supporting the pelvis and the lower back.
So it's all connected. Everything's working together or not working together in the case of piriformis syndrome.
You got it. It's about understanding those connections and addressing the imbalances in a holistic way.
Well, on that note, I think it's time to wrap up our deep dive into the world of piriformis syndrome. We've covered a lot of ground, but hopefully you're walking away with a much better understanding of this surprisingly common condition. If you're struggling with that nagging pain in the buttock and think you might have piriformis syndrome, don't just live with it. Go check out Dr. Muscolino's book. We'll have a link for you in the show notes and talk to a qualified healthcare professional. And as always, thanks for joining us on the deep dive. Until next time, stay curious.
This is Dr. Joe Muscolino again. You've just listened to the AI-generated simulated podcast of the contents located within the ebook. I hope you enjoyed listening to this podcast and you found it informational. Thank you.